What's up, guys? Hey, let's talk about post-acute withdrawal syndrome. All right, yeah. So I'm sitting in my truck drinking coffee from a mug. Um, I may have a problem, but anyway. All right. So everybody knows withdrawal sucks, and I've been doing a lot of videos on withdrawal um, here lately, and somebody mentioned in the comments, let's talk post-acute withdrawal, and I think that's a great topic. All right, so, you think about it, you get past probably one of the hardest things in the world, which is through withdrawal. Now, I know people like to downplay opiate withdrawal. And if you struggle with opiate withdrawal, you're thinking no one has ever downplayed that before. At least no one who's been through it. But I'll tell you, a lot of people think, it's not going to kill you. So what's the big deal? But everybody knows it is a huge deal to get through the opiate withdrawals. Now, some withdrawal are more dangerous than others. Alcohol withdrawal, that will kill you, if not done properly, just depending on situations. Xanax withdrawal can kill you. So there are different levels of acute withdrawal. But when we're talking about post-acute, we're talking about after you're through those couple of weeks of hell. And we know that we can put people in a 90-day rehab. We can detox them appropriately. We can have them off all drugs, medications, etc., and release them, out into the public. And what happens? A lot of times people relapse. And so, folks will say, well, that's just addiction. And yeah, that is part of addiction. Relapse is part of it. But, what's often ignored is this post-acute withdrawal. And so what that is a myriad of symptoms that you can experience for an extended period of time after stopping certain drugs and medications. And, there's no, just concrete data on it, that at least that I know of. And so it may last for a few months. It could last for a few years. So what are these symptoms? Well, it can be depression. It can be anxiety. It can be, poor cognition, memory problems. It can be irritability. It can be sleeplessness, fatigue. You kind of get it, the drift, right? It's those type of symptoms that you might think of. Now, imagine you've been on Xanax and abusing Xanax for years, but all of a sudden you've been in a program, you've detoxed, and you're off Xanax. Well, you might have severe anxiety, and it may be post-acute withdrawal, and it's difficult to know, well, were you just self-medicating the anxiety, or is it this withdrawal syndrome? And the same thing, and I'm guilty too, because a lot of times I'll have patients who we've got them cleaned off of opiates, and they'll just complain of being so tired and fatigued all the time, and I tell them, look, welcome to the real world. Everyone's tired. Everyone's fatigued. No one sleeps great. That's just life. Embrace it. But maybe I'm shortchanging them, because it may just be this post-acute withdrawal, and their fatigue may be, pretty significant. But why does this happen? Now, a lot of this deals with the neuronal pathways that have formed, and the problems with neurotransmitters, those healthy brain chemicals that you need that have just been completely screwed up because of drug use. And it takes time for the brain to heal, but luckily the brain can heal, and you can recover through this. And this leads to the next point. This is one reason when I talk about Suboxone, buprenorphine, etc., why recovery is so important. And I tell you, you'll hear me say, like, Suboxone is not detox, right? Because if you just detox quickly, well, first of all, if you could detox quickly, you probably didn't even need Suboxone in the first place. But let's say you use it to detox quickly, you've still got all this other stuff you've got to deal with, right? And recovery is hard enough on its own. and then you start dealing with these post-acute withdrawal syndromes, man, it's tough, okay? It's no longer about willpower. Willpower is important, but it's not about that. It's about just your complete recovery, your overall health, mentally, physically, spiritually. And to deal with these post-acute withdrawal syndromes, you've got to start laying down a solid foundation. So when you're in recovery, you need to be doing everything you can to put yourself at a place to succeed. Okay, so let's talk about it. Physically, what do you need to be doing? Well, you need to clean your diet up. You need to exercise regularly, okay? Because those things are going to help you rebuild these pathways, get the chemicals flowing, get the blood pumping. You should be doing regular exercise, and you should be trying to get some good sleep. Now, part of the problem is getting sleep, so let's talk about that. Maybe you need to try melatonin. That's an over-the-counter supplement that I tend to recommend to people when they're going through problems with sleep and withdrawal. Now, I'm not giving you medical advice. You talk to your doctor, see if it's right for you. I don't know what other medicines you're on. I don't know what other problems you've had. So it's not a blanket statement. But a lot of my patients get help from that because it's not like a knock you out type medicine. We're just trying to get back to a somewhat decent sleep pattern. So sleep, sunlight. You need to get some sunlight. You need to get your vitamin D up. These are basic things. You know this. I don't have to beat you over the head with this, other than most people just ignore it. And you can't expect to ignore the basics and get the best results from everything else, okay? So, that's your physical. Mental, what do you need to be doing? If you're going through recovery, you need to be going to counseling. You need to have a counselor, a doctor, somebody who's trained in something like maybe cognitive behavioral therapy, or just somebody who will listen and kind of can give you some good advice. Because there's probably a lot of limiting mental thoughts and behaviors that you have developed. And you may not always see that. And so that's going to be important to identify and fix. And that's part of your recovery, okay? You're not going to recover by taking a pill. All right? I mean, the meds help, but that's not the fix, right? Spiritual. I have a lot of videos about God. I'm a Christian. I also have a lot of videos on Buddhism, which may confuse people, but you need to reconnect, because a lot of times, I see this a lot, man, people feel guilty because of their past. And they want to reconnect to the spiritual void, that they feel inside, that they know exactly what they need. But they feel so guilty about their past that they just can't seem to make those next few steps of just. All right, and so this is it. Christianity talks a lot about forgiveness. Well, guess what? You got to forgive yourself too. Okay? Everyone's made mistakes. So just stop dwelling on the past and forgive yourself and start building a better future for yourself and for those around you that you care about, that love you and that you love. Okay? So work on the spiritual. I won't tell you what to do there. But I think that's important, and that's one reason I put these videos up, other than also that's what I like to do, so that's what I'm going to do. So, all right, so physical, mental, spiritual, we covered those, right? Medications, the treatment. It's another reason that you may need a very slow Suboxone taper. And there's a lot of people out there, some doctors even, that will just put people on, standardized tapers that are just too quick, okay? And they may say, well, look, every month you're coming down a little bit more. And you know what? And some people need that. Some people need a little push to motivate themselves. But I find that just a good open conversation with the patient, we can decide what the best approach is. And sometimes people just need more time, okay? Because they're working on all this other, they're working on the mental, the physical, the spiritual, and they don't need to be dealing with the acute withdrawal syndromes, right? And but this whole video was about the post-acute. So let's say you're off everything. You've tapered off Suboxone. You may have post-acute withdrawal. Maybe you need a different medicine. Maybe you need antidepressants if you're depressed. Maybe you need anxiety meds, right? But the thing is, even antidepressants, you can have post-acute withdrawal from it. That's what's so crazy. So it may not be that another pill is what you need, especially if you're not working on those foundational things. You got to build the foundation, guys, before you start putting up the walls. Okay? And I just can't even emphasize that enough. How many people just ignore that part. Okay? Maybe you need to get up 30 minutes earlier every day and work on these things. Maybe you need to start exercising every day. You need to get a routine going. Okay? Figure out what it is. And so I think I covered everything that I wanted to cover in this video. Post-acute withdrawal, it's real. And it can be a son of a gun, man. And a lot of people relapse because they start having those cravings. They get depressed. They've got no energy, and they didn't work on the foundation. So their body's already unhealthy. They don't have any relationships in their lives. They don't have any good friendships, any people they can turn to. And it just slowly sucks the life out of them and they relapse. So if you don't want to relapse, and if you're watching this video and you've watched this long, you don't want to relapse, build that foundation. The storm's coming. Okay? The withdrawal syndrome, you just thought it was over when you made it through those 2 weeks, right? No. The storm's on its way. Suffering is real. But you can prepare. And nothing is impossible. Okay?